The ICMR and the National COVID Task Force have just updated the treatment protocol for COVID-19. Now remember, there has been an admission by the head of the National COVID Task Force as well as the ICMR DG Balram Bhargav that there was overuse, overprescription, overuse of steroids, etc. through the course of wave 2 specifically, and they have cautioned against that. Now, so many people who've suffered from COVID-19 have got a cocktail of drugs that they have been prescribed, antibacterials, antivirals, and what the ICMR has now basically put forward in its new medical treatment protocol is to specify who should use what and when. So let's talk about things like Remdesivir, etc., which were in short supply through the course of the Delta wave and were being used by just about everyone who could get their hands on it. What the ICMR is saying very clearly now is that Remdesivir should be considered only in patients with 10 days of the onset of symptoms, in those having moderate to severe diseases, and they do require supplemental oxygen but who are not on IMV or on ECMO. Also, they are basically saying that things like Tocilizumab may be considered if there is a rapid progression of the disease, that the patient is already on oxygen and not responding to steroidal use, etc. In that case, in consultation with your medical practitioner, only then should you consider administering something like a Tocilizumab. Again, as I point out, there is no mention of things like doxycycline, azithromycin, ivermectin. None of that is part of the treatment protocol. Neither are things like favipiravir, Faviplu, molnupiravir, which has just been cleared by the drug regulator here in India. It does not find its way into the treatment protocol. The treatment protocol is also silent on the antibody cocktail, which was much in use through the course of the Delta wave. Most doctors that we've been speaking to said that it had its use through the course of the Delta wave, but not so much in the Omicron variant, so that needs to be kept in mind as well. And again, as medical experts have been cautioning, please do not self-prescribe, please do not self-medicate, do so only in consultation with a medical practitioner, and steroidal use needs to be done very, very carefully. So these are the new treatment guidelines that the ICMR has put out. All the details are available on their website and of course on the CNBC TV 18 pages as well if you would like to read them in detail and more carefully. But the sum and substance, very specific conditions for when to use Remdesivir, by whom it should be used, when to use Tocilizumab, and as I pointed out, none of the other drugs that were so commonly being used through the course of the first and the second wave find their way in the national treatment protocol.